Welcome to Sessions at www.dearnurses.com. About the host. The host of this program is a registered nurse who's had experience in a number of clinical areas for over a period of 30 years. They include the emergency room, the critical care area, PACU, maternal, and more. Sessions 1. Sessions is by no intention intended to substitute learning of your policies and procedures at your own institution. It's simply meant to help you to enjoy a wonderful profession. Sessions is not a curriculum. It's simply meant to help nursing students and nurses. Now an introduction. Sessions will be pre-recorded and the target or the goal will be clinical nursing. It is well known that most of nursing is performed in a clinical area, so clinical nursing is of paramount importance. Viewpoint. The correct order. It takes time to really become a good clinical nurse, and do not expect to conquer everything at one time. Some nurses love to have exciting stories to tell, but remember that old saying, Rome was not built in a day? Well, it takes time to get there. Some students or new nurses expect to come in and have all the knowledge within a short space of time. Well, this is not reality. Remember what happens? First you crawled and then you walked. Normally you crawl before you walk, so let's start from the very beginning. The new nurse or student nurse who takes the time to know the diagnosis of the patient and why certain things are happening, learn about the medications that are being used, will advance quicker, in my opinion, than the one who expects to just walk in with a storytelling mind. We've discussed viewpoint, and now we go from nurses from old to new. We know that Florence Nightingale was instrumental in doing outstanding work for nurses in 1854 during the time of the Crimean War. During that era, nursing was not very highly regarded. Today, the face of nursing has changed dramatically, and many advancements have been made. You can take a look at the picture here and see during that era, the nursing was very basic. There were a lot of things that we did not have the availability of, things like all the technology that we have today, like EKG reading, the monitoring of patients. We did not have the luxury of these things then. What next? Coming soon will be Sessions 2, and it will be about tasks that seem unimportant. What is the lesson to be learned? You can change your thinking. The focus of tasks that will seem that to you unimportant will be to show you that everything is of some importance in nursing. You have a patient who has had a stroke. I know it does not seem exciting to have a patient who's got slurred speech, probably a weak arm, not able to clearly express what they want to say, but there is a lesson to be learned. You need to change your thinking. And we advise you to go to www.dearnurses.com and check out stroke assessment in the clinical setting to help you learn more about the stroke patient. Next, we have the transsphenoidal patient. This patient has had surgery on the brain in the lower area where the pituitary gland is. The dumping of urine may seem tedious to the nurse who has to pick up that Foley catheter and empty it, but listen, there is a lesson to be learned. The lesson to be learned is something is obviously wrong why this patient is putting out large quantities of pale urine. And the problem can be addressed, but of course you have to change your thinking, not just see it as tedious. What is the lesson to be learned from all this? So look forward to hearing tasks that seem unimportant and the lessons to be learned next time. Hope you've enjoyed this first session. Goodbye.